the chair of the Africa Healthcare Federation, Dr. Amit Thakker, joins us from Nairobi. Great to have you on the program with some very good news coming out of Africa. My question to you is, I want to start with a quote. A former USAID official said, Africa is doing a lot of things right that the rest of the world isn't when it comes to COVID-19. Explain what Africa has done correctly here.
Thank you for having me on the show. Look, Africa over the last many years has pulled up their socks when it comes to healthcare in bringing things together. I think early action is what we've done. We learned from the continents, Europe, Americas, and what the other countries were doing. We were quick on action. So we were literally taking public health measures when the numbers were still in the tens, below hundreds in the countries. We didn't wait for it to become thousands to start taking public health measures. We did that right. The other thing we did right is we've learned lessons of the past. We've realized when Ebola outbreak happened and other epidemics did take place in Africa, we've learned our lesson on how to quickly react when it comes to public health measures and defense in the countries. That's what we've done right.
Dr. Amit, I'm standing here, a bit gobsmacked. My previous segment was about the UK and Spain, Europe being in the midst of a second wave. These are countries with money, with very sophisticated healthcare systems. What goes through your mind when you look at what's happening in Europe right now compared to Africa where you are?
Experience. They just don't have the experience, and they do it too lightly. We've been hit with Marburg, we've been hit with Lassa fever, we've been hit with meningitis, we've been hit with Ebola. The kind of public health experience that Africa has is second to none. So I think the leadership in these countries were probably trying to see it phasing out, and too little too late is what has cost the lives of people in Spain and UK, and that's a fact.
It really is incredible. And just talk us through exactly what were the lessons from Ebola, HIV, AIDS that were put into this pandemic?
Cultural shifts, when there are burials, mass gatherings, churches, prayers. So mass gatherings was one thing that Africa understands should not happen when you have an R2, R3, these very rapidly spreading viruses. That's one. The second thing is everyone understood that partnership makes a difference. It's not that the president will lead or the Minister for Health will lead. It's collaboration, working with both public, private sector, development partners, NGOs, faith-based organizations. It's a team effort. And if there is any leader in the world that they think they cannot take scientific advice or evidence and run making policies and mix politics and policy, you get death in your country. That's what's happened.
Dr. Amit Thakker, thank you so much for sharing with us this very good news coming out of Africa and the very important lessons to be learned for the rest of the world. Thank you. Appreciate your time.
Thank you.